Hi friends, I'm back. I will read certain points from the book itself, direct from the Burnett. James Crompton Burnett, Tumors, Curability of Tumors. I will read certain things exactly from it and try to correlate from our clinical practice. In the previous video, we stopped at stop spot action. I hope you have got that idea. We'll elaborate it more. A consideration of this means stop spot action and the range of action. A consideration of this is highly important because finding out the stop spot in range of action of any given remedy will enable us to winnow the wheel of real cures from the shaft of pseudo cures. He says that you have to find out in this range of action. When you're trying to find out a remedy which goes from the beginning to the end, in the range of action, you have to find out where is the stop spot, where your remedy is getting stuck. You have to find out. I'll give you an example. When I was in my initial years of practice, this is the case which I heard basically from one of my seniors. And I couldn't understand that time because I was in the beginning of my practice. He said there was a patient of pneumonia who was given phosphorus, indicated phosphorus. Partially he was better, fever and everything went, but complete recovery was not happening. His cough and other symptoms persisted. He repeated phosphorus in many potencies as it was indicated. But the desired results were not there. Though patient was almost 70-80% better, but not complete annihilation of the disease was there. And then this physician, you know what he did? He gave tuberculinum. Why? Because in the past history he found out that a few people suffered from tuberculosis, so some tubercular traits were there miasmatically, and after giving tuberculinum, the complete case resolved and the complete annihilation and the symptoms completely went off. He got cured. Two remedies were indicated here. So phosphorus, the question is, when phosphorus was covering everything, all totality, everything it was covering, why did it not completely cure? Because phosphorus has a range of action in that case particular to a level where the tissue damages are there, like symptoms which are manifested till there, but beyond that, where the miasmatic trait is there or some microbes are there, I can recollect many cases where pneumococcinum is being used, bacillinum is being used, staphylococcinum is being used. What is the utility of these remedies? Anti-miasmatic has been used. What is the utility of these remedies? Hence it is said, when you read especially anti-miasmatic, it is said, when well-selected remedies fail to act. What does that mean? Have you ever thought of how can well-selected remedies fail? We homeopathic physicians, our philosophy is such great, law of similars. How can a well-selected remedy fail? It means that physicians, the Kent, the Clark, all the big stalwarts have found out and written in Mater Medica that there is a possibility when well-selected remedies can fail, it can get stuck. This is stop spot action. So we have to understand, we have to find out what is a stop spot action. I can recollect one more case. Tonsillitis. Patient comes to you with a recurrent tonsillitis. You're giving him Heparsil, belladonna, other indicator remedy, constitution remedy. He pains and fever goes off, but this recurrence is not going. And then you start thinking, yeah, my remedy, everything is going, but this recurrence is not going. And then you start thinking, what is stop spot action here? What is the hindrance? What is the block? And then it comes to your mind, streptococcinum. The microbes that are active here are streptococcinum. You give a dose of streptococcinum and probably in many of the cases, the recurrence of tonsillitis completely gets annihilated. These are few examples which I'm trying to make so that you can understand the stop spot action and range of remedy, how much it is important. I'll read a few more things. I'm really impressed by Burnett and I love his articles. The contention that the disease is all expressed in the symptoms. The contention that disease is all expressed in symptoms is one to which I cannot assent. Burnett is saying this because it is not true. We have been taught that symptoms are everything. You take the symptoms, you put your effort, take the symptom, take the symptom, take the symptom. He says that disease is in all symptoms. This idea is not completely true. It may be or maybe not. It is not enough to cover the totality of symptoms. Listen to me carefully. He says it is not enough to cover the totality of symptoms, for when this has been done, we are only halfway. We have to ask these questions. Now write down these questions which are so important. We have to ask these questions. What is the real nature? First question. What is the real nature of the disease? The natural history. What is the natural history of the disease? The past histories and family histories, we are lacking in our case taking. Sometimes we just do not explore from where the disease has come. Patient comes to you, he is sitting there and he's ailing. He's shouting with pain and discomfort. Definitely he's going to talk about the present predominant totality which has to be taken. But you have to understand from where it is coming, why he got it. Past history and family history. Fifth aphorism, when you read, how beautifully Hahnemann has written. Acute diseases you find, the exciting causes, and for chronic disease you have to find the fundamental cause, that is the miasm. How will you know? Going back 5 years, 10 years, 20 years down the line, maybe in the family history, from where the culprit is coming. Once you understand this philosophy, you can crack so many cases in your practice. So real nature of the disease, the natural history, the pathology of the malady under consideration. One side is Kant's philosophy where he talks about generalization, and I use Kant a lot. I cannot practice without Kant. Basically his philosophies are great, but there are sometimes limitations. So we have been taught that pathology is not important, but there are many cases when you're dealing, you should know what you're dealing with. In the patient, what are you dealing with? Is the blood dyscrasia is happening, the bones are involved, marrow is involved, the nervous system is involved, the GI tract is involved, urinary bladder is involved, sexual organs are involved. You have to know that. Now if you look at Kant's Materia Medica, please go and read. He talks about generalization, but at the same time he talks about pathogenesis. He gives this remedy is good for paralysis, and then he gives the kind of action. How does paralysis come? This affects nervous system. This affects urinary tract. This is a good remedy for prostate. He has said that, isn't it? Why? Because they were the masters. They knew this. So real nature, natural history and pathology of the malady has to be there. And the most important question that you should ask in my every case today, once a patient comes, the first question that I ask is, this is what he's saying. What caused it? What caused it? Chill caused it, nail caused it, microbes caused it, miasm caused it. What has caused it? There could be some maintaining cause. You just need to remove that. Maybe no medicines also might be required. What caused it? This is the most important question I feel in homeopathic history when you're taking case. Is the cause still there or it has gone? So once you have identified the cause, is the cause still there or it is gone? Is the drug chosen capable of producing the real disease like one before us? These are few questions that you need to ask. Few more things I would like to cite. In a simple disease of organs, he talks about in simple disease of organs and parts, we can get on beautifully well and cure our patients with joy and satisfaction with the aid of homeopathic specificity of seat or organopathy. The quality of action here is simple and simple homeopathy. Like simple cases, you can find out simple homeopathic actions and you can give and can get some good results. So with this conception, the place of action and the kind of action of remedies carried out in practice with faithfulness, physicians can do great. So the idea is, of course I'm not going to read the entire book, but the idea is that you have to find out the remedies, range of action. What he's trying to explain is that you have to find out the remedies range of action through the disease range of action. What is it? Remedy range of action to the disease range of action. Remedy, and then comes the disease. Remember, my friends, the 20-mile example. You have to walk. So your well indicated remedies can be there, but yes, it can get stuck. He says in some of the plays, I remember where he says, homeopaths should be a good pharmacologist, the pathologist. The pathology has to be known. Once you know it properly, then your mind will start working, and then of course, definitely you can come to the right remedy. To cure disease by remedies, the remedies must stand in some relationship to the disease process itself. No matter whether symptoms reveal the process or not, the symptoms spell out by morbid process. And ultimately he talks about zoic nature of the remedies. What is zoic? The no source. He talks about. And now when we will barge into the cases of his, I will try to explain you, show you that the knowledge of past history, that everything he talked about in cases, he was relentlessly, conscientiously, he would go back and find out the past history and family history, and he uses zoic remedies. What are zoic? The anti-miasmatic remedies. Anti-miasmatic remedies a lot in his practice, and of course the indicated remedy totality also in between. That's how he was able to give such great cures. And he gives, for me, he gives a lot of hope that yes, I can also practice like that, and there are so many suffering individuals that I can, with homeopathy, we can help. So we'll talk about all these aspects in our upcoming videos and lectures. I hope you like this. I hope it makes a lot of sense and helps you. Thank you very much.